I'm Lauren Bell. I'm in nursing 1119, and today I'll be performing trach suctioning. Before we start, we'll go ahead and scan the room.
I forgot like the beginning. And if I can't get the beginning, then I'm gonna be stuck. If I can change it or whatever music, then I'm gonna keep looking at video.
Alright, so I've gone ahead and checked my patient's record for the orders for this procedure. I have provided privacy, I have performed hand hygiene, and I have checked the patient's vital signs and gotten that baseline O2 stat. So now we will go ahead and start. Hey, I'm Lauren. I'll be your student nurse today. Do you mind if I see that wristband real quick for your name and date of birth? Great. So what I'm going to be doing today is I'm going to suction your airway so that you can breathe a little bit better. Do you have any questions about this? All right, great. Well, we'll go ahead and get started. Pull this a little bit closer. So the patient is in a, I've raised the bed into a good working position and gotten them into the semi-Fowler's position. So now what I want to do is go ahead and assess those lung sounds. All right, and just try to take a few deep breaths. All right. Everything sounds great. So what I'm going to do now is hyperoxygenate my client, asking them to take 5 deep breaths. I'll turn my suction on, and for an adult we want this to be 80 to 100 millimeters of mercury, and 80 to 120, and for a child we want it to be 50 to 100. All right, so I'm going to go ahead and place this towel over you so that we don't get anything on you today. And then I want to don my PPE, including my face shield, and I will go ahead and set up my sterile field. My package has already been opened, so I'm reusing it. And I'll get out this. Alright, so I want to go ahead and grab my water, and I would lip this out, and then I would pour it into my cup. And this tab is normally bent back, so I would grab it, but since it's not, I'm just going to pinch here so that I don't reach into that field. So I can actually use this bottom. Straighten that out, maintaining that 1-inch border. Right, and I actually need to turn it around. Right, and in a normal setting, I would not bend these flaps back, but I need to so that it doesn't fall back on itself and contaminate. There we go. Alright, so normally I messed up by trying to put my finger under there, and I wouldn't do that. I would grab here, pick up, and step back. And I don't want to grab here because it has touched the skin, so I really would want to grab on the other side. However, it's rolled under, so I won't do that. I'm just going to leave it alone. Alright. Go ahead and grab my tubing. And all of this is sterile, so I can touch it now. Alright, and I want to connect it to my suction. So now this hand won't be sterile anymore. Alright, connect it, and I would test it. Alright. we're gonna go ahead and begin. Into my water. Alright, now if you could take a deep breath for me and cough. And I'm doing this to make sure that there's nothing left inside the lungs that I need to continue suctioning. Alright, everything sounds good, so I will go ahead and disconnect my suction. Drop this down. This here. And remove this towel. And wouldn't normally put this on the floor, however, running out of room. Well, I can just leave it there. Alright, and I'll turn my suction off, and I want to go ahead and reassess lung sounds. Alright, everything sounds good. So what I want to do now is go ahead and get my patient back into a comfortable position. However, with the trach, we'll need to stay in this semi-Fowler's position. And I can lower the bed, get those side rails up, and make sure the call light's within reach. I'll perform hand hygiene, clean up my area, and I will document my procedure after leaving. Alright, we'll scan the room one last time. Oh, I also should have said that I needed to make sure that that oxygen stat was in between 95 and 100%.